Okay, so you've been diagnosed with heart failure, and your doctor either has probably told you that you have right-sided heart failure or you have left-sided heart failure. My first presentation was on left-sided heart failure because it is the most common and it is the type that is seen the most often. But I also want to go into right-sided heart failure in this video and kind of explain what causes it. And hopefully between the two videos, you will get a better understanding of what causes the problem. Now, in the first video that I did about left-sided heart failure, I went over these statistics. So if you listen to that video, you're going to hear about these same statistics again. But I want you to understand the importance of taking care of yourself as well as the prevalence of heart failure. Now, heart failure in the United States, there's 5 million people that are diagnosed with it every single year. Of those people, 1 in 4 people end up back in the hospital with some type of complication within 30 days of being discharged. So hospitals are really working to try to improve things because they realize that it's a poor reflection on them when people end up going back in the hospital. And I have done a separate video for healthcare providers on some things that they can do to help improve care for their patients, but it's stuff that they have to take the initiative on. First of all, I want us to look at the number 1 million hospitalizations annually. That's people that are newly diagnosed and people that end up going back in with problems. Now, 1 in 4, I'm sorry, that's unacceptable, but that's how many people end up going back in the hospital. And the total cost for care for heart failure runs right at $32 billion a year, and that's just unacceptable. And a lot of times the care is so expensive that it's without a reach for a lot of people, especially if they don't have insurance. All right, I have included a slide with a picture of the heart in it. The main thing that I want you to understand is on left-sided heart failure, the left ventricle, the bottom ventricle that pushes all of the blood to the body, is what is enlarged. But in right-sided heart failure, it is actually the right ventricle on the right side of the heart that accepts all of the blood from the atrium, from the body, and then pushes it to the lung to have it reoxygenated. When there's either a backflow from the body that there's too much volume, or if there is a blockage in the lungs that's not allowing all of that volume to get through, such as with a blood clot, a pulmonary embolus, that's what causes that right side of the heart to enlarge. And another thing I want to call attention to is you see at the very bottom, it's pointing to the heart muscle around the heart. Now, sometimes the right side of the heart can remodel itself to the point that that middle wall in the heart that separates the right ventricle and the left ventricle can actually become thickened and push over into the left ventricle, making it even harder for that left side of the heart to pump. Okay, now let's look at the reasons for right-sided heart failure. First of all, it's hepatomegaly. What does that mean? Hepato means liver. Megaly means enlargement. So if you have liver enlargement, it can make you have difficulty breathing on that side, on the right side. If you have splenomegaly, that means enlargement of the spleen. That happens on the left side. If you have enlargement of the spleen, then that also causes you to have difficulty breathing on that left side. Now, you can also have a lot of fluid buildup in your abdomen, which can be due to problems with the liver failing. And when that happens, there's a buildup of fluid called ascites. And when that fluid builds up, it also increases the pressure in the abdomen and makes it more difficult to breathe. But right-sided heart failure is not really considered a breathing problem as much as it's considered a fluid problem. So, what happens when all of this congestion takes place? All of that fluid sitting in the abdomen ends up causing edema in your feet because if your belly is sitting there full of fluid, it's impeding the flow back from the lower body as it's trying to come back to the heart. You also will find that people have what they call JVD, which is jugular vein distension. What do we mean by that? That is somebody whose neck veins are distended. If you see their neck veins sticking out, when they lay down especially, you'll see their neck veins stick out and you can actually see the pulse going in their neck. It means they've got too much fluid on board. And a lot of times that is a sign that there's something going on as far as preload of the heart, too much flow of fluid trying to get into the heart. And everything backing up is what causes this. We also notice there's a weight gain with these folks. And a lot of time it's fluid related, but if you have a weight gain and you have that peripheral edema, you're going to hear them complain that their feet are heavy. You're going to hear them complain that they feel like they got 2 cement blocks on their feet and it's too hard for them to pick them up. That's the kind of complaints you'll get with these patients. Also, they may have problems with anorexia because they're not eating properly, because when they do eat something, all that extra pressure inside the abdomen causes them GI discomfort, so they just don't want to eat. They would rather not eat than feel bloated, and anytime they eat something, they feel bloated rather quickly. That's another sign. And then, of course, there's the extra heart sounds that come with it whenever you have entirely too much fluid and the heart starts to change shape because of all the excess fluid that's trying to get in there to be circulated. And it's all can be caused by 2 things that is not on this list that that is in the text. And there's 2 things that you need to be aware of. Right-sided heart failure is more often than not a breathing issue as much as it is problems related to the movement of that fluid. Now, it can be caused by left-sided heart failure, can cause right-sided heart failure, or conditions such as sleep apnea can cause right-sided heart failure. So you have to be mindful that even though spleen enlargement and liver enlargement and ascites from liver failure and all that is listed on here, it's basically because the fluid is constricted and can't move through the way it's supposed to. So everything is backing up. So we're going to look at some of the causes of that. Now we're going to look at the causes of heart failure, the first of which is left-sided heart failure. If you have so much problem with your pump that everything is backing up, it could back up clear to the other side, back up in the lungs, back up clear to the other side of the heart. So that's the number 1 cause of right-sided failure is left-sided failure and its inability to be able to compensate anymore. Another thing that you have to look at is pulmonary hypertension, which can be caused by a lot of medications, especially there was one years ago called fen that caused pulmonary hypertension in a lot of people that took it to lose weight. Then there are pulmonary embolisms, which also cause right-sided heart failure because they back up the flow of the blood because they have blood clots that are blocking the flow of the blood in the lungs and causing everything to back up. And then there is also sleep apnea. Anytime that you're not breathing normally when you sleep, if you are not using CPAP equipment, be advised it does cause heart failure over time. Your heart is stressed from not getting the right amount of oxygen, from not getting the right amount of nutrients. It can't function properly because you can't rest properly. So you're both tired. Also, it's caused by liver problems. We talked about ascites from a failing liver. All that fluid builds up around the abdomen. You have to get rid of that fluid if you want to be able to breathe better. And then also we talked about an enlarged spleen. Now the spleen is the part of the body that makes the little immature red blood cells and helps the body's clotting mechanism. And if it gets damaged, if it gets to where you are severely overweight, then it becomes enlarged, just like the liver becomes enlarged with weight problems. When you have an enlarged spleen, enlarged liver, all of those can cause increased pressure in the abdomen, which makes it difficult to breathe. And when you have all of that pressure inside, causing all that added pressure on the internal organs, then it makes them hard for them to function. So I have this graph here that I wanted to show you because it really shows what a person that has this type of heart failure looks like. They're always tired, so you'll hear them complain of fatigue. They have an increase in their peripheral venous pressure, which means they have a lot of swelling in their feet and ankles. They also, if it's liver related, have ascites, and you see how this woman in this picture has a very round abdomen, and that is from having a buildup of fluid in the abdomen from a diseased liver, and the only way to get that fluid off is to have that liver drained, and that literally means sticking a needle in there every so often and drawing off the fluid. Another thing that causes it that we talked about was an enlarged spleen, and you can see that on the left side, that little area that they're showing on the side there, the little organ that has all of the bumps on it, that is supposed to be her spleen, and it's showing an enlarged spleen, which shouldn't be enlarged. But it can be caused due to pulmonary problems, like with pulmonary hypertension and with blood clots in the lungs. And when it's caused by lung issues, it's called cor pulmonale. And that's just meaning that this is a failure that is associated with lung issues. But more often than not, it's related to left-sided heart failure, backing up to the right side of the heart, or it's caused by the breathing problems associated with sleep apnea, where you take pauses at night and you don't breathe. Another characteristic is you see the little line on the side of her neck, distended jugular veins, meaning that those veins on the side of the neck stick out because she's got increased pressure in her abdomen, causing everything to back up. And there's a lot of anorexia because people feel full early because of a feeling of bloatedness and feeling like they're full when they're actually not. They just are really uncomfortable if they try to eat. And you'll hear these people complain a lot about weight gain. You'll hear them complain a lot about feeling like their feet and ankles feel like they're walking around with 2 blocks of concrete on their feet because of the increased amount of weight in their legs and ankles due to the swelling. So the main thing that you want to remember as far as right-sided heart failure are the symptoms of it. Are there a lot of peripheral edema and swelling in the feet and ankles? There is an enlarged abdomen, either from an enlargement of the liver or an enlargement of the spleen or both. These people feel like they have a lot of stomach distress when they eat, so they may be anorexic even though they look like they're heavy because they have a lot of weight around their stomach, which is really actually fluid. And a lot of times they feel bloated, so they don't eat and get as much intake as they need to, which leads to problems. And the biggest thing that they have is fatigue. They get tired very easily, and it's very difficult for them to do things because the amount of effort that it takes to do stuff, it just really wears them out, and it doesn't take very long for people to get tired. That's why one of the key things in the heart guide that I'm offering at the end of this presentation is so important, because there is an activity guide in there for you to plan your day out and give yourself times to take breaks, but plan your day out on things that you would like to accomplish that day. And if you're not successful, then you can always add it to what you plan to do the next day. But you never feel like that it's a failure, because anything that you can get accomplished is a success. Okay, so how are we treating this kind of heart failure? Well, like with left-sided heart failure, you have to reduce the amount of volume that you're dealing with. So it's treated with blood pressure medicines and with diuretics if volume is the issue. If it is the liver and the person has ascites from having the liver fail, then you have to tap that liver and get some of that fluid off, and that's a very painful thing to do. But normally, once a person has to start getting their liver tapped, it has to be tapped several times a week when it gets towards the end stages of it, because it will build up so fast. Another cause in treatment is the pulmonary embolus. You have to treat the clot. If you have a clot that's causing all of the blood to back up and things to not flow along, then you have to treat the clot, and you have to treat the source of the clot. Did the person get the clot because they were a smoker and they were on birth control pills? Because you know that's the main thing that causes these clots, and you can't do birth control and cigarettes. They don't go together. They cause clots. And another thing is sleep apnea. If you have sleep apnea, make sure that you are on a machine of some sort to help your breathing when you're sleeping, and to really make sure that we help with GI symptoms. We want these people to be able to feel comfortable after they eat. So if we have to add something like a probiotic to help move things along, at least give them some GI comfort so they can eat better, because the fact that they aren't eating better is going to affect their health as well. The main thing with these patients is you have to monitor the kidney functions, especially if you have them on diuretics and you have them on blood pressure pills, because it can affect their kidney function if they get too dry. Also, you have to monitor for what the lovely term is, brain fog, that they call it now. But if you have someone that's starting to have a lot of periods with confusion and remembering things, then you have to be concerned about, well, is it an issue with the heart failure, of them not being able to breathe properly because of an underlying issue? So those things are all important considerations. Now, if you want a free copy of this heart failure guide, this is put out by the Preventive Cardiovascular Nurses Association, of which I'm a member. I can get you a copy of this guide if you just email your information to me. I can mail you one. Also, if you don't want to do that, if you don't feel comfortable giving your information out, you can contact PCNA directly and tell them that you saw a presentation that I did on heart failure and tell them that you want them to send you a copy of the guide, and they can do that for you. And hopefully they won't try to charge you for it. If they do try to charge you for it, you're welcome to call and contact me at my email, and I will get you a copy of it for free. But I want you to get your hands on this so you can go through the information, go through all of the logs, and take better care of yourself to do what you need to do to stay out of the hospital, because staying out of the hospital is the key with this disease. And all of the information on right-sided heart failure came again from this Robbins Basic Pathophysiology book. It also came from the same chapter on heart failure, just different section related to right-sided heart failure.